Hello everyone, and welcome to our presentation. Today we'll be exploring an important topic related to Guillain-Barré Syndrome. The title of our talk starts as weak legs, ends with a ventilator. We'll look at how quickly this condition can progress and why prompt action is crucial. Over the next few minutes, I'll guide you through the key signs, risks, and what you can do if you suspect this condition. Let's get started. Let's walk through a typical clinical scenario to illustrate the concepts we'll be discussing today. Imagine a 26-year-old man who comes to the emergency room, complaining that his legs feel heavy. At first, it might seem like fatigue or muscle strain, but within just a few hours, he finds he can't stand at all. Now, 3 weeks prior to this visit, he had a diarrheal illness after eating street food, which is an important detail. When we examine him, we notice that his reflexes are absent, which is a key neurological sign. This case highlights how an initial infectious illness can sometimes lead to neurological complications, and understanding this connection is crucial for diagnosis and management. It sets the stage for recognizing how infections can trigger autoimmune responses affecting the nervous system. Let's look at clinical scenario 2, which we'll call the creeping paralysis. Imagine a 45-year-old woman who's just been recovering from an upper respiratory infection. Suddenly, she starts having trouble lifting her arms. At first, it might seem minor, but as the day progresses, her weakness begins to spread downward. By evening, her chest muscles are affected, and she's having difficulty breathing. What's particularly notable here are the autonomic fluctuations that appear on her monitor. These changes reflect how her autonomic nervous system is also involved in this process. This scenario highlights a key concept. The progression of paralysis can be gradual, and it's not just motor weakness. It can also impact vital functions like breathing and autonomic regulation. Understanding these signs is crucial because they help us recognize the severity and the underlying mechanisms of certain neurological conditions. It ties into our overall theme of how infections can sometimes trigger complex neurological responses, leading to this creeping paralysis that can be life-threatening if not identified and managed promptly. Let's look at clinical scenario 3, which I like to call the tingling teen. Imagine a previously healthy teenager who starts experiencing tingling sensations in his feet. Over time, these sensations move upward, affecting more of his lower limbs. What's interesting here is that the motor weakness, so the muscle weakness, is more prominent than any sensory loss. This suggests that the nerves controlling movement are more affected than those responsible for sensation. When we perform nerve conduction studies, they reveal demyelination, meaning the myelin sheath surrounding the nerves is damaged. This pattern is characteristic of certain demyelinating neuropathies, like Guillain-Barré Syndrome. It's a great example of how clinical features, combined with diagnostic tests, help us pinpoint the underlying nerve pathology. This scenario highlights the importance of recognizing early signs and understanding the mechanisms behind nerve damage in these conditions. Let's start by looking at the overview of this condition. It's called acute immune-mediated polyneuropathy, which essentially means that the immune system mistakenly attacks the nerves, leading to a rapid onset of weakness. This weakness is typically symmetrical, affecting both sides of the body equally, and it tends to progress quickly. Now, understanding what triggers this response is really important. Often, it follows an infection. Common culprits include bacteria like Campylobacter jejuni, or viruses such as cytomegalovirus, Epstein-Barr virus, and mycoplasma. Recognizing these triggers helps us understand the immune system's role in the development of this condition and emphasizes why a recent infection can sometimes lead to nerve issues. This overview ties into the broader theme of how immune responses, especially after infections, can sometimes go awry and cause neurological problems. Let's talk about the mechanism behind this process. Molecular mimicry is a key concept here. It refers to how microbial antigens can resemble our own nerve gangliosides, leading to what we call cross-reactivity. Essentially, the immune system mistakes part of the nervous system for the invading microbe. This mistaken identity triggers an immune response that damages the nerves. The damage can be either demyelination, which affects the protective covering of the nerves, or direct axonal injury, which damages the nerve fibers themselves. As a result, nerve conduction slows down or stops altogether, leading to the loss of reflexes that we often observe clinically. This process highlights how an immune response to infection can inadvertently harm our own nervous system, tying into the broader theme of immune-mediated nerve damage. Now let's talk about the clinical presentation of this condition. Typically, you'll see an ascending flaccid paralysis, which means it starts in the legs and then moves upward to the arms, face, and even the respiratory muscles in severe cases. One of the hallmark signs is areflexia, or the absence of reflexes, which is a key clue in diagnosis. Compared to the motor symptoms, sensory symptoms tend to be milder, so patients might not complain as much about numbness or tingling. Instead, the motor weakness is more prominent. Autonomic instability is also common, and this can manifest as blood pressure swings, tachycardia, or even arrhythmias. It's important to recognize these because they can be quite dangerous. Additionally, cranial nerve involvement can occur, especially facial weakness, which can sometimes be mistaken for other neurological issues. Overall, understanding these features helps us identify the progression and severity of the condition, guiding us toward timely diagnosis and management. Let's talk about the investigations we use to diagnose this condition. One key test is the cerebrospinal fluid analysis. Here, we often see elevated protein levels, but what's interesting is that the cell count remains normal. This pattern is known as albumin-cytologic dissociation, and it's quite characteristic. Next, we have nerve conduction studies. These help us evaluate how well the nerves are functioning. In this case, we typically observe slowed conduction velocities and longer distal latencies. These findings suggest that the nerves are transmitting signals more slowly, which aligns with the clinical symptoms we're seeing. Together, these investigations provide us with important clues. They help confirm the diagnosis by revealing specific patterns in nerve and CSF analysis that are hallmark features of this condition. Understanding these tests connects to the overall theme of how we identify and differentiate this disorder from other neurological issues. Let's talk about management strategies for this condition. The first-line treatments are typically IV immunoglobulin, or IVIG, and plasmapheresis. These are the main therapies used to modulate the immune response effectively. It's important to note what to avoid as well. Corticosteroids, for instance, are generally considered ineffective in this scenario, so they shouldn't be relied upon. Supportive care plays a crucial role too. Monitoring respiratory function is vital because respiratory compromise can be a serious concern. Additionally, preventing deep vein thrombosis, or DVT, is essential, especially if the patient is immobilized. Managing autonomic instability is also key, as fluctuations in autonomic functions can greatly affect the patient's stability. Overall, these management approaches aim to address the underlying immune process while supporting the patient's vital functions, aligning with our broader goal of comprehensive care. Now, let's talk about some of the complications and what the prognosis looks like. One important point is that respiratory failure can develop quite rapidly, so it's crucial to monitor patients closely. Additionally, there is a risk of autonomic dysfunction, which can affect things like blood pressure and heart rate regulation. On a more positive note, the majority of patients tend to recover fully within a few weeks to months. However, it's important to recognize that some individuals may experience residual weakness or fatigue even after recovery. Overall, while the outlook is generally good, being aware of these potential complications helps us manage and support patients more effectively throughout their recovery process. Let's break down this mnemonic. GBS climbs the body like a ghost on a staircase. It's a helpful way to remember the key features of Guillain-Barré Syndrome. First, G stands for ground-up paralysis, which means ascending weakness starting from the feet and moving upward. Next, B indicates that breathing may fail because the respiratory muscles can become involved, which is a serious concern. And S refers to sympathetic chaos or autonomic instability, where the automatic nervous system is affected, leading to issues like blood pressure fluctuations or heart rate changes. Now, the phrase post-infectious immune attack, the ghost awakens after infection, highlights that Guillain-Barré often follows an infection, acting like a ghost that suddenly appears after a viral or bacterial trigger. Overall, this mnemonic helps us visualize how GBS progresses through the body and emphasizes the importance of early recognition and understanding of its pathophysiology. Let's take a look at the exam and practice note for this condition. The key phrase to remember is acute ascending paralysis with areflexia and high CSF protein. This phrase really summarizes the classic presentation of the disorder we're discussing. It's important to always monitor vital capacity and respiratory status early on, because respiratory failure can develop quickly in these cases. Keeping a close eye on lung function is critical for timely intervention. This presentation is a common question in neurology and internal medicine exams, so understanding this phrase and its implications can really help you in those tests. To sum up, recognizing this pattern of symptoms and knowing to monitor respiratory function are essential steps in managing the condition effectively.